Welcome to Shruti Outloud, a podcast where I invite guests from different walks of life to share their stories of following their passion, success, and happiness, which in turn motivates our listeners to follow their heart. Hello, and welcome back to Shruti Outloud podcast. Today's episode is another collaboration with Queen's Lounge by Akanshi Garg, and I'm so glad that we are going ahead with this collaboration and bringing in some people, some guests with a lot of knowledge and a lot of conversations, a lot of motivation, and a lot of learning. So today's episode is no less than what we have done before, and our today's guest is Dr. Dhwani Mago, who is a practicing obstetrician and gynecologist with an experience of about 13 years, over 13 years to be honest. She specializes in high risk maternity care, infertility management, and all gynecological problems. She believes in empowering her patients by educating them about health and healthcare needs. So let's bring her on board and take this conversation ahead. Welcome, Dr. Dhwani. Thank you so much for agreeing to be a part of this podcast and sharing your knowledge with our listeners.
So, hi Shruti, it's great to be here. Much for having me today. Looking forward to this because we are going to discuss a lot of relevant topics for young women, which
So let's start with a simple question, a question about periods. What are the causes of delayed periods, and is it a point of concern when it happens? And if yes, then what should be done by women or young women who are going through the same?
Okay, so causes of delayed periods are 4 5 main causes. Firstly, you need to rule out if you are pregnant. That is the most important cause. And in case you are sure that you're not pregnant, you've done your urine pregnancy tests, then the second reason could be that either you're in stress or you've put on weight or lost a lot of weight suddenly, or there could be thyroid problems, that is hypothyroidism or hyperthyroidism. And also there is a hormonal disorder called PCOD or polycystic ovarian disease that causes delayed periods. So these are a few causes that cause a delay in your periods. And once you have ruled out that you are not pregnant, you must see a gynecologist and get a few basic investigations done to rule out any hormonal issue. So in case maybe an ultrasound or a few blood tests are advised, and accordingly then we advise the patient the next step. So it's a good, very important to keep your periods regular, because later on, I've seen that it causes a lot of, if the PCOD is not controlled in time, it could lead to a lot of other problems, ovarian cysts and number of issues. So yes, you must keep a track of your periods, and they must be regular. So that is, a 21 to 45-day cycle is considered a normal cycle.
In that, I have a follow-up question that say initially young women might experience periods for about say 3 or 4 days. So does the duration change as they grow older? Like say somebody who was in her 17, 18, or maybe early 20s, and she was experiencing periods for about 4 days. But now in her early 30s or late 30s, now the duration has decreased to say a day and a half or maybe 2 days. So is that normal, or is that also a point of concern that should be checked?
So see, the normal duration of periods is somewhere from, it could be from 2 days to say 5, 6, or 7 days. So if it is, just spotting or less than 2 day period, that could be an abnormal period. And if your period is lasting for more than 7 days and you're having excessive clotting, so that again is an abnormal period which needs to be investigated. And yeah, so this could be not necessarily age related, but if your there could be multiple reasons, for decrease in the flow of periods or excessive flow. There are multiple diseases. So yes, you must visit your gynecologist. And sometimes, if your ovarian reserve is falling, and that means your egg quality is decreasing with the age, that could also be one reason that your period, the duration of your period decreases. So if it could be an indication that if you've not planned your pregnancy, so that is an indication that you must start planning your pregnancies. Yeah.
Right. So that brings me to my next question. So I would like to talk about a topic that women of this generation are widely concerned about. So as we all know that we are living in a very fast-paced world, and women sometimes prefer to delay their pregnancy or delay their basically growing their family. So what should they know about egg freezing, and when should they take the decision of going ahead with it?
Okay, so earlier they used to say that women have a very short biological clock. But now, with the new technologies, with the concept of egg freezing, it has been there for a while now, but I feel that a lot of young women don't know about it. So, for career-oriented women, or women who are getting married late, maybe after 35 years, so you must know that your egg quality, it starts declining after 30 to 32 years, and there is a sharp decline after 35 years. So, for whatever reason, if there is a delay in you planning your pregnancy, then a right time to freeze your eggs is around between 30 to 32 years. And one thing, like one like we do our regular health checks every year, I would recommend that all young women must get their AMH levels done every year. So AMH, it's a blood test. It's anti-Mullerian hormone, and this test, it tells you about your ovarian reserve. So once you do it every year, and you are sure that it's in the optimal level, so you can freeze your eggs and delay your pregnancies. But if you realize that it has started falling, so that is an indicator that now you must either you plan your pregnancy, or if you've frozen your eggs, then you're on the safe side. So, and the good part is that you maintained for as long as you want to freeze the eggs. So I would say the best example is of Dinah Hayden. She was Miss World, and she was the one who because of her career choices, she went ahead and she freezed her eggs at the age of, I think, about 26 or 27, and then she had her children after 10 years of freezing her eggs. So, but I still realize that a lot of young girls are not aware of this. So that is the reason I want to educate you and make women aware that this is a very good option that you have of stopping your biological clock. Yeah.
I totally agree with you on this point that at least I'm not sure how it is in other countries, but I think in India, yes, women are not very aware of this fact. And that is the reason why a lot of times the families, when they pressurize women to have babies, they obviously don't know about this option. So they cannot really say something about it, and sometimes they go ahead with the decision even when they are not ready. So thank you for touching this topic and sharing the information on this. All right, so moving on to the next question. A common term heard these days is PCOD. Could you tell us what exactly it is, what are the symptoms, and if there is any treatment, or what can a woman do to be aware of it, and if it happens, what should be done next?
Okay, so I've noticed that during this COVID period, during the last 2 years, a lot of girls, they have maybe because of decreased physical workouts and staying in the house, a lot of young women have put on weight. So PCOD, it is the basic term means polycystic ovarian disease, and it is a hormonal disorder. And it could it could be genetic, or you could develop it if you've suddenly put on weight, or you've been eating too many sugars. So what happens that in your ovaries there are these very small cysts that develop, and the egg ovulation that needs to happen every month, that does not occur, and for some reason the ovaries get blocked, which causes these cysts. So the symptoms could be, like delayed periods, or it could be you could get a lot of acne on the face, or you could have hair loss, or your facial hair could increase, or, hair over your body. And it also causes, derangement of your blood sugars. So the blood sugar level rises, your insulin level rises in the body, and the male hormones, they start rising. So, like I told you, that because of sudden, gaining weight during these 2 years, a lot of women have developed PCOD. So I generally, educate them that, see, we will initiate the treatment, but this is a lifestyle disorder. You need to maintain your sugar levels, you need to maintain your weight, you need to do some form of daily exercise for about 30 to 40 minutes. Decrease the the food which has high glycemic index, you need to decrease that. You need to decrease your sugar intake, all the white food stuff, like white flour, or pizzas, pastas, noodles. So all this needs to be controlled. You need to have a healthy diet, healthy balanced diet, which is very important. So once we initiate the treatment, it helps the patient. The periods come back to normal. You start ovulating regularly. You lose weight also. But then after, say, 3 to 6 months of the treatment, it is you who needs to maintain your lifestyle. You need to do some modifications. You need to be active. And that is how you maintain your PCOD. Because sometimes, I've seen that a lot of times this is, something which cannot be resolved completely. It is there, but you need to keep it under control. So that is something, yeah, that young girls need to be aware of. That keep a check on your weight, be active, and keep a healthy diet. Yeah.
Right. So here I have another follow-up question regarding to the same topic. Does PCOD affect how you conceive? Does it also play a role when, if say somebody, a couple, they are trying to conceive and the woman has PCOD, affect their when they are trying to have a baby?
So see, sometimes, like I said, that because of the fat content, the ovary which needs to ovulate every month, that does not happen. So the cycles are anovulatory. So sometimes that causes a problem in conception. If it is, there are levels of PCOD. So if it is towards the moderate to severe side of PCOD, yes, there could be issues in conceiving, and that's when we help them. We give them some medicines and to stimulate the ovaries better, so that better eggs are formed. So yeah, that is one drawback of having PCOD. So that is why we do a preconceptional counseling. Once the patient plans to have a baby, we call them 3 months prior. We assess everything, and all the tests are done to diagnose if anything is untoward, and we generally treat that before the patient is pregnant. Yeah.
Right. Thank you for answering that question, because I think this is something which is very common these days. As you said that during the COVID, this really happened. So thank you for sharing the knowledge and the treatment and basically the lifestyle changes that young women need to focus on. So my next question is something that came through you, that something that you suggested, and I'm so glad that you did, because honestly, I somehow I could not tap that question and bring it up. But thank you for mentioning that we should talk about this topic. So the next question, the next topic that we are going to talk about is cervical cancer. So, what should our audience know about cervical cancer, and what is the age when women should start getting themselves tested, and how often should they do it?
So, see, cervical cancer is the most common cancer in women in India. And what is cervix? You should know cervix is the lowermost part of the uterus. Okay, that is where your baby grows. That's your womb. So cervix is basically the mouth of the womb, and that is one part that you cannot see. That only your gynecologist can see. So, and the most common cancer is human papilloma infections. So human papilloma virus is, these are viral infections, and they could be transmitted, through sexual activity or, through whatever reason. So you need to go to your gynecologist once a year for an internal checkup, and you must get your screenings done for cervical cancer. That is your pap smear. Your pap smear and your HPV testing has to be done once in 3 years. And there are these vaccines available for cervical cancer, prevention of cervical cancer. So you must go ahead and take it. And all women who are, less than 45 years are eligible for the vaccine. It's a quadrivalent vaccine called Gardasil. So it has there are two types, Gardasil 4 and Gardasil 9. So you need to, the vaccination starts at almost 10 years of age. So once the girls are 10 years old, you have daughters who are 10 years old, please get them vaccinated. And because the earlier you're vaccinated, the better protection there is. And you can take the vaccination up till 45 years of age. So it's very important that you be educated about this. And this is one way that we can prevent cervical cancer and HPV. A lot of HPV infections, warts, and certain anal cancers can also be prevented by this vaccine. Yeah.
Thank you so much, Dr. Dhwani, because honestly, now that you have mentioned it, I did not know about this fact that the vaccines for cervical cancer, they should be started at the age of 10. So I'm just sort of, at a loss of words right now because I don't know anybody who knows this information. And I have got friends who have kids of about that age, and although we are way past that age, but yes, I would really like to show my gratitude to you for sharing this information. And I really hope our audience, our listeners, they take this seriously and go ahead with the vaccines. Also, how often should this be done? Is it an annual vaccine or how it goes?
No, so it's a once in a lifetime vaccine, but it has three doses. So 0, 2, and 6 months. If you are between the age of 10 to 16 years, it's only two doses at 0 months and 6 months. Beyond 16 years, there are three doses at 0 months, then 2 months, and then 6 months.
All right. So, say somebody who is in their early 30s and they want to go ahead with it. So, this would happen within the duration of the three doses.
Yeah, absolutely. So within 6 months, your complete vaccination is done.
Thank you so much, Dr. Dhwani. And I am so glad that we touched this topic. All right. So, lastly, is there anything that you would like to tell mothers of young teenage daughters, and how can they open a conversation with them about sexual reproduction? Because, as I just said, that I have friends who have kids of that age, and we do talk about this fact that they discuss this with amongst all of us, that I don't know how to initiate that conversation. I don't know how to tell that this and this is going to happen, and so changes are going to happen in your body. So could you maybe share few tips or few conversation openers that women can go ahead with while talking to their young daughters?
Yeah, so I myself am a mother and of a 12-year-old girl. So, I would just like to say that once the girls are reaching, say 10 or 11 years, that is the time that you need to start talking to them, because nowadays, the the age of first period has gone down to almost, girls are getting it at 9 years or 10 years of age. So what I did for my daughter was, I started talking about it once she was 9 years old, and I got some books for her. There are these really nice books that you get, which just teach them about basic physical changes in the body and their periods, so that once you prime them, they are not scared once they get their period. It shouldn't be a sudden thing. So there has to be a basic conversation between a mother and daughter, that yeah, this is something which is very natural, you don't need to be worried about it, and this is how it starts, and it just make it like a very natural thing, so that the girls are not scared of this. And also, I would say that you must educate your boys as well. Even they should know about this, that this is what the girls go through. And they should, it's a very normal thing, nothing to be ashamed of. And you can talk about it openly in your family. It's not something that, you have to talk about it in a hush way. Earlier, like, this periods were considered so, it was a taboo topic to talk about. But now, as times are changing, and I've noticed that, yeah, even boys are aware about it. So you must educate both your boys as well as your girls that this is a very natural process, and this is how you go through it. Just you can get some books, and there are these apps nowadays where girls can track their periods. I've seen girls are very smart. They download these apps in their mobiles, and they keep tracking their periods. So that is something that is very important, that you must educate at starting early, say about 9 years. That is a good time. Yeah.
Absolutely. I totally agree with you on this that even when, if I talk about when my period started, I was never very open with my mother. So honestly, I did not learn anything about periods from my mother, and it was my friends who did it. So yes, it has been, as you said, that it has been a uh, taboo topic for a very long time. But I think yes, now things are changing. Now the this generation of parents, they are actually teaching their kids, both girls and boys, about how this is a normal process. This is a like a process of the body, and it happens. So thank you for sharing the little tips, and the way you also did it with your daughter, and the way you have mentioned that there are books and all that can actually help the kids understand. I think that is also very necessary. So if there are any books or anything that you would like to recommend, that would be really helpful.
I I don't remember the name, but I can you maybe share it later with you. But the apps I remember, there was like a flow app, which is very which helps her to track her periods. And the books, you'll get a lot of books on Amazon, about this. So you can just go ahead and search. Yeah.
Absolutely, absolutely. That's a great idea. That basically introduce them this through books. So
And the school really helps. I've noticed that the school teachers, they really help with this. They start talking to the students about this from class 4 or 5 onwards. So that is also it's a nice way to prime the students, in school. So that also really helps. Yeah.
absolutely. And I think, the times have really changed, because back when I was in school, and there was this chapter on the sexual reproduction. And I remember how our school used to sort of, separate boys and girls. And even with girls, when the teacher was teaching, she was just reading, no explanation done whatsoever. So, yes, I think times have definitely changed now, and for the better.
Absolutely, definitely. Yeah. And I also want to tell that, women should be aware of their fertile periods, because, what is your fertile period is when you have intercourse. During that period, you land up in pregnancy. So you must take extra precautions and use contraception if you are having contact during that period. And that is from day 13 to day 17 of your cycle. if you have a regular cycle of say 28 to 30 days, and the first day is taken as the day you start your period, that is day 1. So you calculate from there. So day 13 to day 17 is the fertile period. So you know when you have to be extra cautious, and if you're not planning a pregnancy, so please use your contraception.
Absolutely. Thanks for adding that tip, that point in this conversation. And Dr. Dhwani, thank you so much for being a part of this podcast and sharing all the information, sharing all the knowledge. And I'm sure that there might be some follow-up questions. So I'll get back to you if there is anything at all. And possibly we can do another episode on some another topic or something.
Sure, that'll be great.
And as you said that, you believe in empowering women through sharing the knowledge about health and health problems. And that's exactly what you did with us on this podcast. So thank you once again for being a part of this.
Thank you so much. It was lovely talking to you. And yeah, looking forward to more episodes. Yeah.
All right, Dr. Dhwani, have a great day. Bye.
Bye bye.
Shruti Out Loud welcomes all stories. It can be a brand, it can be an organization, or it can be a person. The only thing common would be passion for life. Please subscribe to this podcast on Spotify, Google Podcast, Apple Podcast, Amazon Music, Ghana Podcast, and every other platform where you can hear this. Please leave a review as that helps my podcast to grow. Thank you once again. See you for the next episode. Bye.